This is Doctor Talks, real talk from real doctors on the issues that matter to you most.
Hello, everyone. My name is Dr. Richard Horowitz, and I'm the co-host of the Doctor Talk Healing Lyme Summit 2.0. It is my great pleasure today to introduce you Ray Solano. He is the head of PD Labs. This is a compounding lab that has a novel delivery system for prescription drugs with some of my favorites that you're going to hear about, which is methylene blue and low-dose naltrexone. So, Ray, thank you for joining us today. Tell us about this novel delivery system and kind of how you got into this in the Lyme world.
Well, thanks for having us today. We want to really get the word out that there's different ways to get these unique molecules that are so powerful into the body. And so what we have started is, we were always a sterile compounding pharmacy, but unfortunately, the regulatory nightmare and being able for stability of these drugs is difficult. So we look for different ways to get these unique small molecules into the cells. So we partnered with a pharmaceutical company that had a unique patented method of taking a nanosphere, super low levels of a pharmaceutical or a nutraceutical, down to 50 nanometers, and then enveloped it in a phospholipid layers. More than that is all the patent will allow me to talk about, but makes a small molecule that attaches to the outside layer of these cells and gets absorbed very quickly. So you get something that, again, easily absorbable. It has less side effects because you don't need that much drug, and it is something that's stable. Many times doesn't require refrigeration. So, one of the things that, is one of your favorites, we've worked on a number of, our call to fame is the synapsin nasal spray, which we developed about 10 years ago. And again, these insoluble compounds are the difficult ones. And then we tried it out on your favorite, which is methylene blue, and you may want to say, well, the methylene blue is easy to absorb. You can take it, liquid in many different ways. However, you've done a lot of work in a lot of your papers on high dose methylene blue.
Yes.
And methylene blue in high dose sometimes gives side effects. And so the magic is, how do you get, the benefits of the high dose, but without the side effects?
Mm-hmm.
And we feel very strongly that that's the mantra of this new delivery method. Getting the drug into the cells with a lower amount to do its work without causing all the other Herxheimer reactions.
So that would be, by the way, this is almost too good to be true, right? I mean, for me, because you're right. I mean, the thing is with dapsone combination therapy, and I was just a little while ago, I was speaking to Dennis, and I was telling him, like, we're applying for NIH grants, right? So we're going for an R34 grant from multi-center, placebo-controlled, randomized dapsone trial. And of course, I have to use methylene blue because it reverses one of the major side effects of dapsone, which is methemoglobinemia, where you don't carry oxygen well in the blood. Now, I've been using methylene blue now in different doses for years. I find generally the low doses are never a problem. In fact, I can use low doses, really, people don't notice anything. But you're right. As you get up to the higher doses, you have to be careful. They can't be on psych drugs because you have to worry about serotonin syndrome, right, in these type of people, and agitation. They have to be on low histamine diets because if they're not, methylene blue can raise blood pressure with an MAO type effect. You'll get a little bit of urinary burning, right, mostly in women, but in men at the higher doses. So I've been able to work around it. And fortunately, it's allowed me to do high-dose dapsone because for Lyme and BART, I've needed higher dose methylene blue and higher dose dapsone to knock these bugs out. I mean, that's why we're designing a randomized trial. So I hope to work with you, and I think this is the way you and I are going to probably do this in the next year. Since you're just developing, and people should know also this new formulation of methylene blue, I'm taking it. You sent me samples of it, and I'm actually on it right now. I decided to try it because, that's how I am, and I'm taking your 10 milligram, and I feel fine. My energy happens to be good. I'm not sure if that's the reason for it because they're using it for mitochondrial dysfunction and Alzheimer's. We'll get to this in a second. But it's interesting because what I'm going to do with you over the next year is work with you, get labs on patients on dapsone with your formulation and do a control and use the regular methylene blue use your formulation and find out, like, instead of maybe using 300 of methylene blue twice a day, which is what I need to keep the methemoglobin, by the way, at about 5%, 6% on 400 of dapsone, maybe with your product, I'll be able to use a tenth of the amount. I won't know until we actually do this. Have you been able to do any of the comparison studies so far on like comparison of the strength of this tablet, of this novel delivery system versus, the liposomal forms that are out there?
Well, right now we have some mostly anecdotal information. We team with practitioners like yourself that be able to have case studies on individual patients. We've been doing a phospholipid liposomal capsule for many years, and Dr. Dennis Katz and Hopkins Drug pioneered this formulation, and then we found that when we did liposomal capsules, that a 25 milligram capsule would be equal to a 50 milligram just regular powder. So there was usually always a much more efficient usage of a liposomal capsule for many, many patients. However, when we use this form, it's a solid state liposphere, which is totally different. It's even more efficient that the body's able to absorb it. And so this is the reason why the 10 milligram tablet, some of our anecdotal information is almost equal to like a 50 milligram powder form.
So you might be talking even a 5-to-1.
About a 5-to-1 is what we're looking at. And if I could just give you a little bit of grounding, we use this with testosterone as well. And testosterone is injectable for many of these patients that we had been using. And we were able to get free levels of testosterone equal to an injections, but using over 7.5 milligrams a day of testosterone. So we were getting equal to 5 times absorption with a chewable testosterone tablet than we would for an injection.
So hold on. For people who don't know about hormones,
right,
that is unheard of. Because first of all, you're not really supposed to be able to take oral testosterone
right.
in that form. I mean, if I want to raise men's testosterone, I'm using, Clomid, 50 milligrams, half a tablet, 3 times a week to go to the pituitary and say, hey, make luteinizing hormone, right? To kind of push it up, and then maybe use Arimidex, anastrozole, to stop the aromatization of testosterone, to estrogen. You're saying you don't need, for example, doing those type of things, especially injectables or cream. By the way, and again, for people that don't know about hormones, these wear off over time, right? So a lot of times you give a cream to someone, they don't, right, if you don't have to. So you've tested the blood levels, this testosterone, and you've...
We have, and Dr. Andy Heyman is pioneering this study with his patients, and we're getting these clinical trials started. We got close to we got 8 patients in the trials now. We need 5 more, but we're really validating that again, these molecules can be manipulated and be able to get super high levels of absorption. So,
and first pass effect in the liver, you're not getting a first pass effect.
Well, that's right. We're not getting the estrogen effects. We're not getting the liver enzymes. And that's what's really exciting. So every time we take a molecule in one of these products and we put it into this form, we're getting great results. And low dose naltrexone is the next one that we are coming out with as well, the LDN. And again, we're talking anecdotal information from some of the patients and clinicians, but we're getting at least 3 times more effectiveness for the drug. And tirzepatide too, it's used for the weight loss drug. We've done this. So we feel we have a pretty good database that we can do the trials like yourself with your premise that we're going to improve outcomes for patients. There's no question about it.
Well, no, this is exciting because, we're in the R34 planning grant for this NIH trial right now, trying to get funding. I'm working with Eva Carolinas. I have a great biostatistician, Nicole Close. She's run these trials. Right. But what's great for me is it is always the side effects of dapsone that I have to worry about in these trials, right? So the anemia, I've kind of been able to work around with high-dose leucovorin. I'm using like 100 milligrams twice a day. I'm using L-methylfolate, 60 milligrams twice a day. So question for you, since we're on this topic of this novel delivery system, so I will not, you're saying if I'm, let's say it's a 5 times ratio. So you might be able to give me theoretically a methylene blue at 50 or 60 milligrams of this tablet, this novel delivery system, which would be the equivalent of the 300 that I need to lower methemoglobin on high dose dapsone without worrying about like serotonin syndrome because they're not getting the same amounts of methylene blue in the
Right.
system.
That's what we're thinking is that we're getting a higher cellular absorption. And I think the side effects you're talking about is the extracellular fluids and the extracellular methylene blue that it's affecting the other receptors that's causing all the side effects.
So, you know,
And
what I'm
so
going to suggest on this is that when you and I do this coming year, when let's say you send me samples of different dosing, and then we go to the labs, we're gonna have to do this well because assuming the R34 grant gets accepted and we write the trial, which I'm hoping right now it looks like it probably won't start till 2026, I have to provide information for the FDA and for all of the boards, right? When we apply for this for the IRB, to show the equivalence that we have a study. In fact, we may want to publish this. You and I may want to publish this together because then I'll be able to use your formulation of methylene blue and the dropouts for the trial may be less. Now, normally I can get people through this without them dropping out, but obviously if I could provide a safer, even more effective way.
okay, repeat the question one more time.
So how did you learn about this technology?
Dr. Jim Laval, a partner with us with the Laval Performance Health Center, had met Dr. Sean Hack and mutually at a conference and explained the philosophy of this novel compound. And Jim took it and said, you know, this is exactly what we've been looking for because we have so many of these insoluble compounds, curcumin, EGCG, all these items are very difficult to get absorbed into the body. They're only curcumin is only, absorption is only 0.5%. So you have to take so much of these drugs, of these either nutraceuticals to get absorption.
Mm-hmm.
So that's how we started with it. And we realized this is a gap of being able to put these products in a nanosphere, 50 nanometer size. It gets the body absorbs it so much differently. So that's how we got it started. And we realized this kind of adaptation. It was the silver bullet that we all have been looking for quite a while.
So I mean, like we all know that liposomal, you know, a lot of times, you know, this in the products, they'll use things like BioPerine, the black pepper extract for absorption. We sometimes will give liposomal formulations of other things with other drugs we're giving because they may be pulled in. So this is even superior, you're saying, in some ways to the liposomal.
Well, exactly. If I can make it really quick, you know, when you get down to the nanometer size, the particles break apart. And when you put them in this phospholipid, the ionic charges of them don't come back together. They actually separate. So they don't conglomerate. When you have regular lipospheres, liquid lipospheres, guess what? Over time, they come back together.
Mm-hmm.
And that's when they become a complex and they don't really work. But these actually repel. We actually have a microscope screening of showing these little particles that are going through on the microscope, and you can see that they don't come together. They stay separate, that's what we think is happening. So this is why a nasal spray that we would normally do as a nasal spray, we could take a tablet and get the same results.
That's amazing. Yeah, that's really amazing. Congratulations. I mean, this really sounds like cutting edge research being put into practice. I mean, it's fabulous.
And you know, we think it's cost effective for patients. It's not a premium. It's not tenfold more expensive. You know, chronic diseases, we congratulate you on all the work that you've done for thousands and thousands of patients. And you're always looking for different ways. Who would ever thought of putting dapsone in use for Lyme? I mean,
well, I mean, the truth is I don't know if you know how I came up with this, but it's when John Hopkins, I went back like 8 or 10 years ago, they said, oh, Lyme, by the way, Borrelia burgdorferi is a biofilm persister bacteria, which meant not that it persists, we knew that, but that it's a persister like mycobacterium, like tuberculosis, leprosy. So I looked up leprosy and I went, rifampin dapsone cures leprosy 1 year. I said, let me look at the qualities of dapsone. Great central nervous system penetration, lowers inflammation through myeloperoxidase, right? Helpful for autoimmunity, has anti-malarial effects, hits persisters. It was like, oh my God, it's checking all the boxes. So I said, let me put doxycycline with it, with rifampin and dapsone that they use for leprosy, and it was a home run from day one. But now, with what you're saying is we may be able to do these clinical trials and not have patients worry so much about the side effects. So question for you, if this is such an amazing, which it sounds like the technology is amazing with, this unique delivery system, what about the folic acid? Like right now, I have to use massive doses of leucovorin and L-folify, right? 15 milligrams of L-methylfolate, 4 twice a day, just 3 twice a day, 4 twice a day to stop dapsone-induced anemia. And I haven't found it to affect the efficacy of dapsone. It just helps to block the anemia. Is it possible that maybe you could also make an L-methylfolate formulation or even put leucovorin standard drugs and do that with this formulation so people don't need so many pills?
That's what we're looking at, and again, looking at the chemistry, if it's insoluble and it's difficult to absorb, that's usually the checkbox of getting forward. So, we're building out our pharmaceutical division next to us. We're going to have an expansion of a new building, and so that we'll be able to do more of this work, because we definitely, especially like L-methylfolate. I mean, it's an older medication. It's been around, so we're not infringing on anybody's patents. So it's a perfect candidate for those type of things.
No, this is great because I'll have about a year to actually play around. You and I are going to discuss getting samples and dosing and stuff, but we have to do this. You and I have to sit down separately and we have to design this. So for example, it's 5 patients on dapsone, 200.
Right.
And I compare 5 patients on dapsone with this level of leucovorin L-methylfolate and then your formulation and look at the anemia, compare the CBC.
Right.
It'd be fascinating.
Fascinating. Well, as you can see, there's great things that we're going to be able to do together, and we're really excited.
That's wonderful. Well, congratulations. So how do people get in touch with you, Ray? How do people learn about PD Labs and at this point access some of this amazing technology?
Well, check out our website, pdlabsrx.com, pdlabsrx.com, and we have a physician's page on the top that you can be able to access our formulas. We have many of the unique LPT, that's the family, there's LPTs in supplements that are on our e-commerce page. But it's really easy to get a hold of us, pdlabsrx.com. Our phone number's there. Is 888-909-0110. And easy to get a hold of. And guess what? I still work in the pharmacy and answer the phone.
You're still in the front lines. You're still doing this. And wonderful for you that you're developing, because for all of us who've been in the field for a long time, when you start like pushing the boundaries to improve patient care, right? Finding things that no one's done. I mean, it's exciting, right?
It's exciting time. Exciting, and that's what we do. So, well, thanks for getting us on the Doctor Talks, and we're going to have we have our own podcast, so follow us on Healthy Choices podcast as well.
Excellent. So again, for those of you who've been tuning in, my name is Dr. Richard Horowitz. I am co-host of the Dr. Talks Healing Lyme Summit 2.0. We've been with Ray Solano from PD Labs talking about really some amazing new technologies for delivery systems in the body. So Ray, congratulations. I look forward to working with you actually and improving patient care together.
There we go. Well, great. Thanks again.
Okay. Thank you so much.
Okay.
Bye-bye, everyone.
Thank you for tuning in to Doctor Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Doctor Talks. Real talks from real doctors on the issues that matter to you most.